From the Western Mass News studios in Springfield, this is Western Mass News Getting Answers with Dave Mattson.
Thanks for joining me for this week's edition of Western Mass News Getting Answers. I'm Dave Mattson. Good to have you with us. Every week I'm joined by federal, state, and local leaders and newsmakers to talk about the issues that impact you. This week we're getting answers from the President and the CEO of Baystate Health, Dr. Mark Keroack. Under his leadership, Baystate Health has extended the reach and variety of its clinical services, incorporating 2 new community hospitals and growing its outpatient practices all across the regions. And that's just the tip of the iceberg. This week, time permitting, we'll talk about his concern for a 4th wave of COVID, the surge in COVID cases in recent weeks, the impact of COVID-19 on the Baystate Health System, and health care after COVID. Welcome, Dr. Mark Keroack. Good to see you.
Thanks, Dave. Thanks for having me.
Thanks for taking the time to be with us. I know it's very busy these days. The one thing we're all talking about is is COVID-19 and that Delta variant. Over the past 2 weeks, new coronavirus infections have risen by 148% in the United States, and those numbers could have changed by now. Hospitalizations increased by 73%. How concerned are you about this? And as you mentioned before, we're in that next wave.
Yeah, I think it's already happening, Dave.
Yeah.
We have gone from 4 cases in the hospital about 3 weeks ago to 30 today. So clearly the 4th wave has hit Hampden County, Western Mass, and it's all about the Delta variant at this point.
Dr. Fauci saying this past Sunday on the news program, things are going to get worse. Looking at the acceleration of the cases, the 7-day average has gone up substantially. You agree with that?
Yeah, Delta is very much a game changer and it's going to be a different kind of outbreak than we had back in the spring of 20 or over the holidays. We know that in the Provincetown outbreak, for example, 880 cases, 75% were vaccinated. Now, nearly all of them just got minor colds or flus or no symptoms at all, and only 7 wound up in the hospital. So I think there are going to be a couple of different kinds of outbreaks we see, of outbreaks of colds and flus in folks that are vaccinated, and then outbreaks of more serious illness in those that are not yet vaccinated.
We talk about the Delta variant. There's been a couple of variants now, and also breakthrough infections. One of the things that we really hadn't seen a lot before this is people who have been vaccinated getting the virus.
Yeah, I think many of us felt that once we were vaccinated, we were kind of immune and we could go ahead without any worries. I was certainly among them. But Delta has been very much a game changer. The ability to cause infection in people who've already been vaccinated and cause shedding of virus roughly at the same level of people that had never been vaccinated, I think really changes the dynamic of what we're recommending. Now, the vaccine is still highly protective. It's 95% or so protective. You are roughly 10 times less likely to get infected if you're exposed, if you've been vaccinated. And even if you get infected, you're 20 times less likely to end up in the hospital. So the vaccines are still highly effective, but to think that you're going to somehow manage to avoid infection entirely is just not in the cards with Delta.
Now, these variants were fully expected, weren't they?
Yeah, these viruses kind of make mistakes when they make daughter viruses, and so they're constantly throwing out variants. Most of them are not effective and die out, but 1 in a million, 1 in a billion times, something that's highly adaptive and outcompetes the older variants comes about, and that's what happened with Delta. Started in India.
It did, but again, there's no surprise with people who have gotten the vaccine getting the virus, because I remember when we're getting it, this is not the cure-all. It just won't be as bad if you do get it.
Right. I think that the level of protection against the first variant, called the Alpha variant, was much, much better though than Delta. And I think the reason that Delta changes things now is not only is there less in terms of protection against infection, but the Provincetown outbreak has shown us that even if you do get infected after vaccination, you might pass that virus along to people who aren't vaccinated. And that's the real danger.
And again, that goes back to getting vaccinated. And we've talked about this, the reluctance of people this far into the COVID-19 pandemic to still get that vaccine. Does that baffle you with that, why people just won't get it?
Well, it's a complex puzzle for sure. I think in the country as a whole, about 50% of people have been fully vaccinated. That number goes up to 80% if you look at folks over 65. But it's not all one kind of problem. I think we see a lot in the media of people who are dyed-in-the-wool anti-vaxxers, but those are really just a minority of what we're seeing. We also see individuals who don't think COVID is such a big deal. I'm young, so I'm not going to get COVID, or it's not going to be serious for me, which is wrong. I think I might have gotten it before, so therefore I'm not going to worry about vaccine. Also wrong. Or I haven't gotten it yet, so I'm not going to get it. Also quite wrong. There also are breaks in terms of racial and ethnic divides, conservative liberal divides, rural urban. So it's a wide variety of people and a wide variety of attitudes that we're seeing, and so I think it really requires kind of customized messaging and customized outreach.
How frustrating is it for you as a medical professional, the misinformation, and we've heard a lot about this as far as misinformation on social media getting out there, that must be an almost impossible battle to fight sometimes.
Yeah, it's really difficult. Some of the really crazy ideas about microchips in your body or effects on fertility. I mean, these are sort of sensational things that cause people to be bewildered. I think the great majority of people who are vaccine hesitant are just kind of confused and scared by all the stuff they're seeing. I think particularly if they're getting their news from social media, they have been fed a steady diet of rather outlandish stuff. And so really we've been trying to get simple, direct messaging out there that the vaccine is safe and it's highly effective. We've been trying to get it through individuals who are seen as authentic and authoritative. But really, I think the key breakthroughs at this point are going to be as a result of people who are close to individuals needing to be influenced. There's a great saying that was told to me back in medical school, is that they don't care how much you know until they know how much you care.
Well, the other thing now is you hear more and more people. I think over the past week I've heard more and more stories from doctors who are treating people who are very, very sick with COVID saying, I wish I had gotten the vaccine.
Yes, by then it's too late, obviously. Yeah. There's a 3-week spacing between doses, and you don't really get full antibody, excuse me, until 2 or 3 weeks after that second dose. So if you decided today that you were going to be vaccinated, your full protection wouldn't occur for about 5 or 6 weeks.
Now, the other part, too, is the issue, early on was there wasn't enough vaccine available. That's not a problem anymore, is it?
No, vaccine is really abundant, and our rate of vaccination here in the state has actually come down. We were, at the height of it, giving out 80,000 doses a day. These days, it's more like 7,000 to 9,000 doses. Now, that's still a faster rate of vaccination than the rate of infection. So we're gaining on the virus every day in the state. But I really would love to see us get back to, full speed like we were doing back in January.
Indeed. Now, and last week, Baystate Health announcing you're requiring employees to be fully vaccinated by October 1st. Other major companies are following suit. What's the reaction been internally to that?
I think that there are some people who are upset by it. I have gotten far more people thanking me for the decision than objecting to it. I fully expect that there are going to be some people who are going to decide to leave the organization rather than be vaccinated. But in good conscience, I just couldn't see us not helping people feel safe when they came into our facilities.
You see more and more companies and businesses following that lead?
Yeah, there have been 50 or 60 national organizations, medical organizations, that have endorsed this, like the American Hospital Association, American Medical Association, but even large companies like Disney, for example, public-facing companies are requiring this.
Yeah. Dr. Keroack, we're going to take a break, and when we come back, we're going to talk about getting back to normal or the new normal, whatever that may be. Welcome back to Western Mass News, Getting Answers. My guest this week is the president and CEO of Baystate Health, Dr. Mark Keroack. We've touched on a lot of things and even more to touch on. Let's talk about the Baystate Health System itself. Is it back to normal, or is it becoming a new normal for you folks?
Well, it's certainly not back to normal. We're seeing a resurgence of non-COVID diseases, people who have put off care. So things have been very busy in the non-COVID side of things. And we're still trying to recover from some resignations and early retirements that happened during the pandemic. So we're actively recruiting, and we have shortages of staffing, particularly individuals in entry-level jobs. And so it doesn't quite feel like normal yet, and there are a number of things that I don't think will ever come back to normal.
Baystate Health is hiring then?
Oh, for sure.
Yeah.
We have over 1,000 vacancies. If you have
that many?
Yes,
wow.
If you out of our 12,000 employees, and we are doing a number of things to make it attractive to start a healthcare career. We've gone to a $15 minimum wage, for example. We have 30 different health professions that trained at Baystate in partnership with a variety of colleges and universities. So we're trying to build our own pipeline for workers, and we have a variety of apprenticeships and after-school programs, et cetera. So we've really redoubled our efforts to attract people and to retain them too.
Sure. Are you finding people who put off surgeries and visits to doctors now, are they coming back, or is it a slow process?
Oh, I think they're mostly coming back. I think the one area where we have not seen a resurgence, a complete return of volume, would be in the emergency room. So people with minor colds or flus or sprains or whatever are opting for either their primary care doctor's office or urgent care, which is, I think, a good thing. But in terms of elective surgeries and medical admissions, we have been full up at most of our hospitals.
Really? Now, as far as the changes that you made at the hospital in response to COVID-19, are there some that will remain in place? A lot of things we learned through this. Yeah,
I think that there are a number of things that are cued on how much COVID is in the community, like the mask wearing in the hospitals. We still have a visitor restriction, so one visitor per person with some exceptions. Those will either go away or be adjusted based on the amount of COVID that's in the community. But a number of the ways we work as teams and how we coordinate work, some of the things we've learned during the pandemic, a bit more around flexibility and ingenuity, I think that's here to stay, and I think it's a good thing.
You know, we look at masks and we see them coming back now, but one of the things I've wondered, because over the course of the winter, you hear countless stories about the fact that there weren't as many colds, the normal flu season wasn't as bad. Do you see once we get through all of this, do you see greater use of masks in the winter months? Because I look at it and go, well, now it makes sense.
Yeah, we've had almost no flu this year. Yeah. And I know for years we used to look at people in Asian countries and kind of chuckle about the fact that they all wore masks during the flu season. Well, guess what? I think they were onto something. I have no doubt that if we were to wear masks regularly, we would have less problem with colds and flus during the winter. Will people do it? I think that's a big question. Yeah. I might do it, and I think we're not going to find it odd years from now to see somebody wearing a mask during the winter months in a grocery store, let's say.
Sure. I mean, you mentioned as far as the restrictions, as far as one visitor. Are you looking at this every day and the possibility that there may be further restrictions?
Yeah, there's a complex formula that has to do with the amount of virus in the community, the rate of test positivity in our testing centers, and the percentage of people who are vaccinated. And, there are red, green, yellow, and white zones. We're kind of in the green area, which is mild risk. And so we're not totally back to normal, and we're going to be keeping it up, particularly now that we see case numbers going up in the greater Springfield area.
You know, one of the things that impressed me through this whole thing, the weekly news conference with the mayor, and how the medical community and the business community and the governmental community work so well together during this.
Yeah, I think that we didn't have any of the political rancor of, red, blue, whatever. Governmental leaders, business leaders, and the medical leadership all synced up and really put their minds to it. And I think that's one of the reasons why we've done so well. I think we are the #2 state in the country for vaccinations, and certainly the #1 big state. And part of it is the consistency of messaging.
Yeah. I looked at that, and my dream, I think, for the perfect world would be maybe the folks at the federal level can see what's being done at the local level and how easy it is to work together when it's a common goal.
Yeah, I think there was a certain level of trust and respect that was mutual right to start off with. We basically see ourselves as part of a larger community. I work quite well with and have regular meetings with all of the legislative and civic leaders, as well as folks on the federal level. And we're full partners with the Economic Development Council and a variety of the business groups as well. So these folks are not strangers. And it was wonderful to me to see who our friends were. When we were having all these PPE shortages, people in the construction trades and manufacturing trades just gave us what they had. And it was just, it was almost like that movie, It's a Wonderful Life. You sort of find out everybody was really pulling for you all that time.
Yeah, in the worst of times, you see the best coming out of people,
yeah,
for sure. Mm-hmm. One of the things we haven't talked about is telehealth. I mean, just more and more of that, as far as that staying around and the benefits to that.
During the height of the pandemic in the spring of 2020, so April, May, we went from a few hundred telehealth visits a week in our practices to tens of thousands. We have about 100 different places where care is either delivered or supported, and about 100 different practices. It went up to be 80% of the ambulatory visits were telehealth. But even now, even during the lull that preceded this latest wave, it was still at 30%. And many of our physicians and patients have found it to be far more convenient. There are certain things that need face-to-face.
Sure.
But it varies specialty to specialty. Some of the specialists are doing the majority of their work via telehealth, and others kind of pick and choose depending on what's needed.
All right, we're going to take another break, and when we come back, we're going to look at the impact that COVID-19 has had on the rising costs of healthcare. That's when we come back. Welcome back to Western Mass News, Getting Answers. I'm very pleased to have the president and CEO of Baystate Health, Dr. Mark Keroack, as my guest this week. Dr. Keroack, let's talk about spending on healthcare in Massachusetts. Numbers that I saw, it hit more than $64 billion in 2019, a 4.3% increase. State cost control target, things like that. Let's talk about the rising cost of healthcare, because I think that's obviously it's a concern for everyone.
Sure.
How am I going to pay for this if I don't have the right kind of insurance and things like that?
Yeah, Massachusetts is one of the most expensive states in the union, which is why we've layered on a number of state-based oversight groups like the Health Policy Commission that keeps track of that. They had been doing a pretty good job up until the pandemic hit of keeping spending below that 3% ceiling that they like to do. And I think it needs to be said that Western Mass is the lowest cost region of the state. We're much more like the national average. A lot more spending goes on in the greater Boston area, where prices are higher and also the utilization of services is higher. Once the pandemic came, I think that it's really time to think about getting the system reorganized and retooled and refitted. And I'm a little concerned that the Health Policy Commission is trying to do their same old thing and look at just the rate of rise, when in fact we've incurred all kinds of extra expenses for personal protective equipment. We've had to pay bonuses to get people to sort of do extra shifts. We've had to hire very expensive contract labor. So I think that the whole cost issue has to be looked at when we get back to a sort of a normal run rate. And quite frankly, I think Western Mass has done a pretty good job. We've been a leader in the state in keeping costs low.
Well, that was the other thing. When the pandemic hit, it wasn't a question of, okay, we have to wait for the money to come in to do this. You just had to react to it and do it.
Yeah, Baystate keeps reserves, and one of the reasons that we are regarded as a stable financial institution is that we had hundreds of millions of dollars in the bank in reserves. This is required for us to borrow money, et cetera. And so we started spending down those reserves at a very brisk rate. I mean, about $150 million of spending. Most of it was covered by the subsequent CARES Act, the relief bill that went through in 2020. As of today, our spending has been, in terms of extra expenses and also lost revenue because we had to cancel cases, et cetera, has been about a $150 million hit. I'm sorry, we've taken in $150 million. The expenses are in the $180 to $190 million range. So there's still about a $40 million gap. And as we've said, the epidemic is still ongoing. It's coming back for a fourth round.
So this is something, you can't turn this around in a matter of months. This is going to take years and constant working to bring things back to where they were pre-COVID-19.
I think some of it will never change because the resignations and early retirements have left us with a hole that's going to take many months to fill. We have a couple of hundred nurses now who are in orientation and training who are going to come online in August and September. But we probably still need that many more again to really get completely up to the right level. And as far as the people in some of the entry-level jobs, such as the nurses' aide jobs, the environmental services workers, food service workers, we've got a number of vacancies there too. And we're going to be doing our very best to get people back, but I suspect we'll need to pay higher wages to do that.
How is the overall picture, your staff doing? Because we talk about the strain that the early months of the COVID-19 pandemic did on the frontline workers. I mean, that's not, there has to be long-term effects with something like this. How do you ever get back to normal from that aspect?
Yeah, I think we've done a lot to try to support staff. The short answer is it's different with every different person.
Sure.
People react differently to stress, and some people really need intensive assistance or else even to take a leave from it all. Others seem to be more able to bounce back, and it just varies from person to person. But we've had a variety of enhancements in terms of benefits and phone support, employee assistance programs, et cetera. But yes, we've been very cognizant of that in terms of not asking people to do extra things or new things. We've really put a pause on a number of the strategies we had that were on the launching pad prior to the pandemic, because really at this point I think we need to recover as an organization and totally restaff.
We talk about assistance from the state and federal governments. Do you see down the line that Baystate and other institutes, we're going to need more of that?
Well, yes, we are about $40 million short in terms of the expenses as of today, and that number is likely to grow over the next few months. We are applying again to the Federal Emergency Management Authority, or FEMA, to get additional assistance. That might be $15 to $20 million in that application. And I know that the Mass Health and Hospital Association, on behalf of all Massachusetts hospitals, is petitioning the legislature to include some additional assistance to cover some of the gaps that the CARES Act didn't cover.
Yeah. I can't, from someone who has utilized the services of Baystate Health, and our family has, I can't thank you enough and the folks that you have working for you there. I mean, they're angels.
Well, thank
Indeed.
you very much. We've been really very proud to serve, and we've been very grateful for the community support too. It's really been terrific.
And there is light at the end of this tunnel.
Yeah, I think if you look at both England and India have had Delta epidemics. England's a good comparison because they're reasonably well vaccinated and they tried to reopen the country. The Delta outbreak there did tend to peak after several weeks and seems to be going down now. I can only hope that that's going to be the script we follow here. I do think we're in for a bit of a hump in the next few weeks to months, but I don't think it's going to be anything near as bad as what we had during the holidays.
Dr. Keroack, I can't thank you enough. Thank you for joining us, and I thank you at home for joining us too. I'm Dave Mattson. Stay safe, stay well, and if you can, join us next week.